Did you know that the skin is actually the largest organ of your body? And it's really important in ICD-10-CM coding because this is where all of our codes for pressure ulcers are located. So today we're going to go over the skin and the musculoskeletal system in ICD-10-CM. Hey everyone, I'm Victoria. I'm a medical coder, auditor, educator, and content creator, and on my channel I provide tips, tricks, and tutorials because I want you to be successful in a medical coding career. The integumentary system is probably my favorite in all of medical coding, and the musculoskeletal too, but you need to have a very close attention to detail when you're assigning codes, particularly related to fractures, because there's a lot of different components that can go into the correct fracture coding code. So let's go ahead and take a look at the skin and musculoskeletal coding guidelines. I mentioned last time that chapter 11 actually doesn't have any guidelines. We're moving right to chapter 12, which is diseases of the skin and subcutaneous tissue, starting with pressure ulcers. So there's a big section of pressure ulcers in category L89, and they identify the site and the stage. Let's switch over and take a look at some of these codes. So if we're looking at this L89 section, you can see, for example, and I'll zoom in here, this section here, which is our L89.11, we have here not only pressure ulcer of the right upper back, but then it gets into the different stages of it. Is it unstageable, stage 1, stage 2, stage 3, stage 4, deep tissue damage, or unspecified? Now, so ICD-10-CM classifies pressure ulcer stages based on severity, stages 1 through 4, deep tissue pressure injury, unspecified stage, or unstageable. Assign as many codes as needed to identify all of the pressure ulcers the patient has at those different locations and different stages, if applicable. Unstageable pressure ulcers. So there's a difference between unstageable versus unspecified. Assignment of the code for unstageable pressure ulcer should be based on the clinical documentation. These codes are used for pressure ulcers whose stage cannot be clinically determined. So if there is an ulcer that they're looking at and there's something covering it, like a burn or necrosis or a skin graft or eschar or some kind of slough, sometimes they can't stage it because of whatever is covering it. They don't know how deep it goes. So when they cannot determine the stage because of that, it is considered unstageable. Unspecified is when there's no documentation at all regarding the stage. So those are two different concepts, unstageable versus unspecified. Unstageable, they can't determine the stage. Unspecified, they didn't even document any stage. Assignment of the pressure ulcer stage could be guided by clinical documentation of the stage or documentation of the terms found in the alphabetic index. For clinical terms describing the stage that are not found in the alphabetic index and there is no documentation of the stage, the provider should be queried. Pressure ulcers documented as healing should be assigned appropriate pressure ulcer stage codes based on the documentation in the medical record. If the documentation does not provide information about the stage of the healing pressure ulcer, assign the appropriate code for unspecified stage. If the documentation is unclear as to whether the patient has a current, meaning new, pressure ulcer, or if the patient is being treated for a healing pressure ulcer, you can query the provider. For ulcers that were present on admission but healed at the time of discharge, you assign the code for the site and stage of the pressure ulcer at the time of the admission. If a patient was admitted with a certain stage of pressure ulcer and it evolved to another stage during that hospital admission, what happens is you assign two separate codes, one for the site and stage on admission, and then a second code for the same ulcer site and the highest stage reported during that hospital stay. So if it started at a stage 1 of the leg and then evolved to a stage 4 of the leg, you would code both of those. Pressure-induced deep tissue damage. So for pressure-induced deep tissue damage or deep tissue pressure injury, assign only the appropriate code for pressure-induced deep tissue damage, which typically ends with that sixth character of 6. Non-pressure chronic ulcers, and just a side note, you have to be very, very careful when you're coding for ulcers because sometimes providers will flip-flop their terminology, which does impact the code selection. There are different codes for ulcers, non-pressure ulcers versus pressure ulcers versus a wound. And sometimes providers will use that interchangeably. They'll say they have a sacral wound and then it's a sacral ulcer, and that really makes things unclear as far as what codes to assign. So patients that are admitted with non-pressure ulcers documented as healed, you don't assign a code for that because once it's healed, it doesn't have anything, so no code is assigned if it's documented as healed at the time of the admission. Non-pressure ulcers documented as healing should be assigned the appropriate non-pressure ulcer code based on the documentation in the medical record. If the documentation does not provide information about the severity of the healing pressure ulcer, non-pressure ulcer, assign the appropriate code for the unspecified severity. If the documentation is unclear as to whether the patient has a new pressure ulcer, if the patient is being treated for a healing non-pressure ulcer, query the provider. For ulcers that were present on admission but healed at the time of discharge, assign the code for the site and severity of the non-pressure ulcer at the time of the admission, same as we do for our pressure ulcers. Patient admitted with non-pressure ulcer that progresses to another severity level during the admission, same thing. You would assign two separate codes, one for the severity at admission and the second for the highest severity during that whole inpatient stay. Next is our chapter 13, which is diseases of the musculoskeletal system and connective tissue, starting with site and laterality. A lot of the codes that are in this section are the fracture coding, so all the different types of fractures that a patient could have are bone-related diseases. Most of the codes within chapter 13 have site and laterality designations because in most bones you have laterality, a right and left femur, for example. The site represents the bone, joint, or muscle involved. For some conditions where more than one bone, joint, or muscle is involved, such as osteoarthritis, there is a multiple sites code available. For categories where no multiple site code is provided and more than one bone, joint, or muscle is involved, then you use multiple codes for each of those. Let's take a look again at our ICD-10 manual so I can show you an example of these multiple site codes. Here's our book, and we'll zoom in here a little bit so you can see on here, for example, we have this diagnosis code of idiopathic aseptic necrosis of bone, and then it says multiple sites. So that's what it looks like. It has that multiple site designation on the musculoskeletal bone disorder. Bone versus joint. So for certain conditions, the bone may be affected at the upper or lower end, such as avascular necrosis of the bone, which is M87, osteoporosis, M80 or M81. Though the portion of the bone affected may be at the joint, the site designation will be the bone, not the joint. Acute traumatic versus chronic or recurrent musculoskeletal conditions. Many musculoskeletal conditions are a result of previous injury or trauma to a site or are a recurrent condition. Bone, joint, or muscle conditions that are the result of a healed injury are usually found in Chapter 13. Recurrent bone, joint, or muscle conditions are also usually found in Chapter 13. Any current acute injury should be coded to the appropriate injury code from Chapter 19. Chronic or recurrent conditions should generally be coded with a code from Chapter 13. If it is difficult to determine from the documentation in the record which code is best to describe a condition, make sure you query the provider. Coding of pathological fractures. So the seventh character A is for use while the patient is receiving active treatment for the fracture. So think of A for active. While the patient may be seen by a new or different provider over the course of treatment for a pathological fracture, assignment of that seventh character is based on whether the patient is undergoing active treatment and not whether the provider is seeing them for the first time. So don't think A is necessarily the initial encounter, it's the active treatment of that condition. The seventh character D is used for encounters after the patient has completed active treatment and is now in their routine healing phase or recovery phase for that condition. The seventh character listed under each subcategory in the tabular list are to be used for subsequent encounters for treatment of problems associated with the healing, such as malunions, non-unions, and sequela. Coding for complications of surgical treatment for fracture repairs during the healing or recovery phase should be coded with the appropriate complication code. Osteoporosis is a systemic condition, meaning that all bones of the musculoskeletal system could be affected. Therefore, site is not a component of the codes under category M81, osteoporosis without current pathological fracture. The site codes under category M80, osteoporosis with a current pathological fracture, do identify the site of the fracture, not the osteoporosis. So category M81, osteoporosis without current pathological fracture, is used for patients with osteoporosis who do not currently have a pathological fracture that is due to the osteoporosis, even if they've had a fracture in the past. For patients with a history of osteoporosis fractures, so they used to have the fracture, it's healed now, then you can use status code Z87.310, personal history of healed osteoporosis fracture, and that should follow the code from M81. Osteoporosis with a current pathological fracture. So now the patient currently has a fracture that is due to the osteoporosis. Then you use the codes from category M80, and that does identify the site of the fracture. A code from category M80, not a traumatic fracture code, should be used for any patient that has osteoporosis who suffers a fracture, even if the patient has a minor fall or trauma, if the fall or trauma would not normally break a normal healthy bone. If you look at some of the codes from this M80 section, and again, we'll zoom in so we can get a better look at some of these. So this M80 section here, you pay attention to these seventh character extensions. So A is that initial encounter for the fracture, D is the subsequent with routine healing, and then we have G for subsequent encounter of fracture with delayed healing, K for subsequent encounter for a fracture with non-union, P for subsequent encounter for fracture with malunion, and then S for sequela, so the late effect. That's the end of the guidelines for chapter 13, so we'll be picking up next time with chapter 14, diseases of the genitourinary system. I hope you found this video helpful. If you did, make sure you give it a big thumbs up. Don't forget to subscribe and hit that notification bell because you're going to want to get alerts when I post these new and helpful episodes. I will see you in the next episode, and until then, just keep on coding on.